Healing isn't linear. Some days you feel okay, some days you won't. Both are part of the process. Welcome to Mental Health Matters, the podcast where we talk real about what mental health actually feels like, raw, unfiltered, and human. Today's topic is one everyone relates to: healing, whether from trauma, heartbreak, burnout, or depression. Healing isn't easy, and coping isn't always pretty. That's why and I'm excited to talk to Ariane Kamba,
Yeah.
Vadele Mbounou. Welcome, ladies.
Thank you.
Could you please introduce yourself to our audience?
Okay. I'm Vadele Mbounou. I'm currently a student at McGill studying international development, and I'm also a co founder of Cameroon's Jewels, which is a nonprofit jewelry business that focuses our profits into supporting the youth. And I'm also very involved in the community, the African community in general. Recently, I was president of the Dawson Afro Caribbean Club, and I try to involve myself in a little bit of everything, and it's a pleasure to be here today.
Thank you.
Hi, my name's Ariane Kamba. I am a wellness therapist. I have a lot of modalities under my belt as an RMT, nutritionist, fitness, Reiki, energetic master. So I've done a lot, as well as being in finance in the automotive industry. I worked and toured with artists for many years until COVID hit, the game changed, and I myself went through a lot of traumas. So I'm excited to be here. Thank you for having me.
Thank you. You're welcome. Let's break down the myths and talk about healing and what it feels like. Ariane, what does healing mean to you?
Hmm. Healing, definitely not linear, as you mentioned. I believe that healing is returning to your true frequency, um, not the one that you're forced to survive in, but returning to self. It's not about being perfect at all. And we're not broken. I feel like a lot of people think we're broken. We're not broken, we're misaligned. And that's part of life. Things happened. It's not about being perfect. It's not about being whole. It's about being whole, sorry.
Mhm.
And a lot of people think healing feels good. It's not. It's actually the opposite because you're really going through either emotional, physical recalibration. And I find it's confronting. It confronts all aspects of your being. A lot of people don't want to heal, but when you do, it's pretty powerful, yo.
Healing isn't fixing yourself, it's learning to hold your pain with care. Vadele, why do we feel pressured to get over it quickly?
Because the process is, let's say, it's long and complex,
Mhm.
and it's not like, because the final product is what we want. The final product is peace, is understanding, is everything. But to get to that final product is a lot of work, and we want to obviously skip to that part and just like get there. So, but obviously, you don't just get there without doing the physical, mental work, everything that's needed. Yeah.
That's right. There's no deadline for healing. It's a process. And Vadele, from your experience, like you said, from trauma and depression, what are a few health coping mechanisms that you have seen actually work?
Breath work, meditation, it is a life. We don't breathe properly. We do not breathe properly. We do not breathe properly. And breathing is literally life. It gives you life. You need it to survive. But when you start learning different types of pain, breathing, you can help with the pain. It can help with anxiety. Because we're energetic beings, we get a lot of energy stuck in our system. So when we're healing, we want to be able to move past the blockages. So again, I'm a huge, huge, huge advocate of breath breathing. There's a lot of different ways of breathing, and meditation, coming home to self integration. Those have been mine. I actually, throughout all, like, I feel like I stopped drinking or stopped doing things that were not good for me when I started healing. And a lot of people will just suppress. And I was like, no, let's go.
Face it all.
Yeah. Yeah.
And Vadele, what kind of coping mechanisms that you use if you feel like
Uh,
that you use for healing?
Coping mechanisms for healing. Think I think meditation is very, very important. At some point I was really into meditation. Like that was what grounded me. Like I would try to do it
It's
at
life.
least like once a day for 10 minutes. And like at first it's like it's hard to because your mind is always so busy. The whole like
Mm,
point of is just to like like try to just put everything on the side and just focus on breathing. That's it. And at first it was so difficult, but then once it started working, I was like, oh my goodness. Like the whole day is going better. Everything is working so much better. And even your processing is so much better.
mhm.
But unfortunately, I fell off of I fell off of my like routine of meditation, and I'm trying to get back onto it. But meditation is it's very helpful.
That's right.
Yeah, a lot of people think it's woo woo, but you'll see even Harvard studies will show that it grows. Your frontal cortex grows, gray matter.
Mm-hmm.
It does so much for your system, just 10 minutes. And I know we think it's supposed to sit there and we can't think of anything. No, it's being able to watch your thoughts and let it go, not being stuck in them, or dancing or moving. Those are forms of meditation. It's not just sitting there, it's something where you just get in the present.
Mm-hmm.
As
Mm-hmm.
long as you find yourself in the present. And it could be like if you're in a business, you could be like, okay, I'm staring at a table in your head. It's
Mm-hmm.
white table. There is like planters with green cactus,
Mm-hmm.
just being able to see what's happening and bring yourself back and breathing and being present. I think a lot of healing is because we're out of presence.
Mm-hmm.
We're dysregulated. We live out here.
Mm-hmm.
So we create havoc.
Mm-hmm. So to bring awareness, there are some people who actually use harmful coping mechanisms or strategies. For example, some people would say, when I'm in pain or when I'm emotionally challenged, I drink
Oh, so
or
many
I
people.
smoke or they use drugs to numb the
Yeah.
pain.
Or Netflix.
Or
Or
yes,
Watch
binge scrolling.
binge scrolling. Like they'll literally be like this. Like, or watching a show for a whole day to like numb anything that's numbing, to not deal with anything.
Yeah.
yes, because we have one of the drug addicts. They said because they were grieving, they lost a loved one. So because they were grieving, they didn't know how to take care of the pain and the healing, and they started using those drugs. And then at the end of the day, became an addict, and it was difficult now to heal or to come out of that episode.
There's a lot of victim mindset out there. They started, and then you kind of become like a victim, or I did this because of this, X,
Yeah.
Y, Z. They're not
Like,
dealing or taking
mm-hmm.
responsibility for their emotions. What you want is to be able to feel your emotions,
Mm-hmm.
and we're being taught to disconnect from them through all of these external
Factors all around us.
factors.
Yeah.
But you want to be able to say, you know what, I lost someone, I'm sad. Journal.
Mm-hmm.
Write your journaling down. Very healthy. It gets everything on paper and it leaves room for yourself. Went through a divorce. I've never gone through a divorce. I don't know what that would feel like. I've had breakups and I can tell you they're not fun.
Mhm.
I've ugly cried.
So how did you heal?
Oh,
How did you pop up and heal from that breakout?
when you understand that everybody's a mirror of what you're feeling, or life is mirroring you what's happening on the inside, you start taking responsibility for the right action. My last breakup, I knew that he loved me and in his own way, and I left the situation because he wasn't really being honest and he wasn't as available as I thought he would. So after that breakup, I looked at myself. I'm like, where was it that I was negligent of myself, where I was not available for myself?
Mm-hmm.
Where was it that I felt the disconnect within myself?
Mm-hmm.
And I was like, oh, you know why? XYZ. I look at everything as a learning, growth, evolving. We need to evolve in life.
Mm-hmm. Yeah.
That's
Constantly evolving.
Yeah,
Yeah.
constantly evolving.
Yeah.
that's right. How can you help someone, Vadele, if you see someone expressing emotional triggers?
Um, well, experiencing emotional triggers, I think we would try to like, maybe I would try to discuss with them on like the current emotions that they're feeling, and then like why they're feeling those emotions, and then try to like look at different healthy things that like they can do actively to try to like either help them manage their emotions or like push them further into their healing journey, because it's easier to fall into something that is bad for you, something that's not that's going to affect you negatively, whether it's mentally or physically. And especially when facing a difficult emotion, it's very hard to process, especially if you're like really overwhelmed or tired, and on top of that you're feeling sad and you've had like a difficult day. It's easy to just resort to, okay, I'm gonna binge scroll or binge this, or like, oh, like let me smoke a cigarette, or let me
Yeah.
like drink like a full or half a bottle of wine. It's just like,
You feel so much
no,
worse
it's,
after.
yeah, you feel so much worse after. And it's like, and the harder thing to do is to really sit and reflect with yourself about those emotions.
Yeah.
That's so much harder, trying to like understand yourself and why am I feeling this way. At first it's hard, but then like the more often you do it, the better you get at it. Because I used to like, when I would have like a hard difficult day and everyone was pissing me off, I would fall into my bed and start like binge scrolling for like
Mm.
maybe an hour or so, and then I would feel much worse because obviously screen straight into my face for an hour scrolling into like random content. And then slowly I started getting into the habit of, okay, you haven't had a good day, obviously, maybe like this is how you're feeling, this is why you're feeling this way. Like, what's something, maybe take like a nice bath, maybe like write, journal a little bit, meditate, do something that's gonna make you happy. Yeah.
Ariane, how do you attempt to your clients when they face sudden emotional triggers?
When they're being triggered,
Mm-hmm. Just sudden.
sometimes they need to vomit what is bothering them. So I have to be able to listen to them without judgment
Mm-hmm.
and not compare the story. This is like their time.
Mm-hmm.
This is their needs. It has nothing to do with me. Um, Once it's out, it's a lot easier. They feel already lighter,
Mm-hmm.
right?
Mm-hmm.
And then if it's something to do, because there's so many forms of healing, so it's kind of, I deal more with physical healing. So I would maybe do a cranial sacral therapy where it's more rebalancing of the cerebral fluid, or something like a reflexology, which is again circulation. And I can do some tapping where it's going to have them come bring their body down to a homeostasis where they feel stable. So because I have a lot of modalities, I can influence the treatment according to what they're feeling. It's not just like, come lay down.
Mm-hmm.
No, no, no. It's like, let's make it personal to you. What do you need in this moment? Do we need soothing? Do we need this? And a lot of fascia. We hold issues in our fascia, and a lot of people aren't familiar with fascia, but fascia is a web like tissue that connects everything down to your cellular level, your muscles down to your cellular level. And so if it's tight and if it's in a certain way because of emotions or repetitive motions, we learn to unwind those fascias through EFT, which is emotional, um what am I having a blank right now? Emotional fascia release.
Mhm.
or different types of stretches, because a lot of our issues are in our tissues,
Mhm.
and a lot of our, let's say, angers are held in different parts of the bodies. So it's also knowing where you're holding that tension. We need to be able to take a step back and be like, okay, where is this in my body? Breathe. Sometimes it's the chest, or sometimes it's my stomach. Okay, what can we do to release that? And as us, we can do it on our own self. When you're starting to feel whatever, spew it out in however
Mhm.
way you can, and just say, where am I holding the tension in my body? A lot is in the lower back. Men is a lot in their traps as well. Everyone's overthinking in their head.
So
What can I
massage can
do?
help.
Absolutely. There's
Okay.
so many modalities that help. For me, massage is not a luxury, it's a necessity. You
Mhm.
bring your car to the garage, why not your body?
Mhm. Some people say they turn out to food when they are stressed. They eat a lot, and
Oh,
sometimes they.
yes.
Do you think food is actually something that helps?
Yeah, because it releases dopamine, all kind, like some foods is like serotonin, like chocolate, it feels good, right?
Mhm.
Or some people will get addicted to even sex. They'll just find someone to just sleep with to feel good because it releases serotonin, right? So you have uh different neurotransmitters in your system that.
Why do we sometimes feel worse before we feel better?
Why do we feel worse?
Mm-hmm.
That's healing. It's like,
That's just the
right.
cycle
It's
of
just this
life.
like
That's just
cycle of life.
Mhm.
Doing the podcast, even putting it all together. It's not the editing, right? The
Mhm.
editing will be like the healing. Oh my gosh, this could take
Yeah.
forever. But
Mm-hmm.
at the end, you get the package. It's a beautiful package. So it's it's life. Anything worth doing, it requires the work that goes in there. So
Mhm.
you will feel worse. I have modalities, even just as a massage. Sometimes, if you're going through things and we're working on something, it's going to hurt, or you might feel sick because there are things being removed. Your toxins are being removed, or we're recalibrating your system, and your system is so used to being tight in certain ways that when we're going somewhere else, it's like,
Mm-hmm.
I don't like it here. I don't feel comfortable here. So I want to go back the way I'm going. I feel comfortable. And then we're like stretching or like, no. And then until one day it becomes a habit. It takes 21 days to break a habit, it says,
Mhm.
for you to start feeling the way you should be feeling.
Mhm.
That's
We
right.
resist, right? We
Mm-hmm.
resist so much. We resist change. We love comfort. We
That's
love
right.
comfort.
What about medication? Because sometimes you find some people, especially when they are feeling mental challenges, when they are prescribed for medication, they'll say, I won't take it because it's not helping me. So I would rather be me and not take it. What would be your advice to people like that? Do they really need that medication, or do you just say, no, it's okay?
I can't speak for anyone, and legally, you should always consult with your doctor. But with my knowledge and me having gone through things, maybe a little dosage, a little bit, but to not get hooked on it. When I went through my accidents, I'm baffled at the amount of medications. They were like, take for this, but nobody asked how I was doing, if I was moving, or they were just giving me things. I'm like, but you need to know my hormone levels for this. And
Mm-hmm.
because I'm kind of in the wellness, I know a lot about my body. So I was like, I'm not taking half of the stuff they gave me.
Mm-hmm.
There's things that I took in moderation, but I also cleaned it out of my system. I
Mm-hmm.
would drink chlorophyll water if I'm taking all of these antibiotics,
Mm-hmm.
because it gets lodged there, and you actually get worse if it stays stuck in your system. So it's a whole ecosystem, your
Mm-hmm.
body.
Mm-hmm.
I also am not a big fan of medication. I
Mm-hmm.
just came out from the hospital in February,
Mm-hmm.
and I was baffled at the lack of questions they
Mm-hmm.
asked about what was happening, and they were quick to just boom, 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 here you go, pull push. Like, it's the pharmaceutical industry, it's $1 trillion industry. So
Yeah.
for a reason.
Yeah.
And And I feel like a lot of people like to have the idea that I have a medication and they have like, oh, I have to take this for this.
Mm-hmm.
There's some people who just say, I have this, I need this, but I believe in energy, movement is medicine, and being in the right environments. I think there was this one doctor who had asked a client after 30 days and he goes, I meditate, I changed my diet because your
Mm-hmm.
diet is huge. He
Mm-hmm.
changed his diet, he started meditating, he
Mm-hmm.
started moving his body, he started walking, simple things that we should all be doing, and he was feeling so much better.
Mm-hmm.
He had pressure, what is it, blood pressure. He was supposed to go for a surgery for his liver. Like, he had so many things going, and within 3 months he didn't need anything. He lost 40 pounds and he's loving life.
Wow.
So we tend to listen to our doctors, which you should, liability wise here, but you have everything within you. Your body talks to you if you really get present with it.
That's right. Vadele, what would you say to someone who is in silence, suffering, and think that healing is not working for them?
Well, I would say that first it begins with breaking your silence. And then healing is not, maybe I think healing is going to start working once you start believing that it can. Because if you're from the get go, you're already shut down, not open to talking to anybody, you don't believe it's going to work, then it's going to be hard for it to actually happen. So, first, it's break your silence and then actually give healing a chance. Like, be open to really going through the whole process, talking to someone, taking advice from professionals, and really trying to center yourself and get into more contact with your body and mind, of course.
That's right. Healing is a process. There are so many coping tools and mechanisms or strategies for healing. Spiritually, meditation, prayer, holistic approaches, medically or scientifically, medication. Food is medicine, health, diet. Laughter is medicine.
Mhm.
So if you are not feeling well or if you feel like you are not healing, don't be in silence. You need a circle. You need a support system. Reach out to your family, your friends, your colleagues, because if you have laughter, you heal better. Healing isn't about forgetting. It's about learning to live again. You don't have to be okay all the time to be healing. You are not failing, but you are just feeling. It is not a straight line, and it isn't something you owe to someone. If you are surviving today, that's enough. If this conversation spoke to you, share it with someone who needs help. Follow us from more real talk about healing, emotions, and mental health. Just know that you are not alone. You are not broken, but you are healing your way. Vadele, thank you for coming today.
Thank you.
Ariane, thank you for coming today.
Thank you for having me.
And thank you to our audience for listening. We also appreciate and acknowledge our sponsors. You all have a good day. Remember, take care of yourself, love yourself,